Ask any first-year medical student to describe a complex facial injury, and they will immediately recite the Le Fort classification. From emergency rooms to radiology suites, trauma surgeons and ENT specialists rely on this exact system every single day to assess and reconstruct shattered faces. But while the fracture lines are neatly drawn in every modern syllabus, professors rarely discuss the methodology behind them. Beneath that sterile, clinical terminology lies a deeply unsettling history of how we mapped the breaking points of the human skull. In the late 19th century, French hospitals were seeing an influx of devastating injuries from industrial accidents and early conflicts. Without modern imaging, doctors were essentially operating blind. They couldn't accurately predict how the complex facial skeleton broke beneath the skin, forcing them to rely on dangerous guesswork. This slightly conspiratorial understanding fueled a grim folklore that still circulates in medical schools today. You'll hear rumors of a rogue surgeon dropping cannonballs onto human corpses or pitching severed heads down mine shafts to see how they shattered. Those dramatic cannonball stories are entirely false. The documented historical reality, however, is much more clinical and far more visceral. This brings us to Dr. René Le Fort, a highly decorated French military surgeon, driven to understand the catastrophic trauma seen in his patients. He possessed a unique pedigree. Coming from a distinguished family of physicians, Le Fort became the youngest person in France to earn a medical degree at just 21 years old. As he studied victims of severe impacts, he proposed a radical idea. He hypothesized that massive blunt force trauma to the front of the face did not naturally travel into the fragile base of the skull. Instead, he believed the complex bones of the mid-face functioned as an independent shock absorber, an anatomical crumple zone designed to sacrifice itself to protect the brain. To prove this theory, Le Fort knew he could not rely on patient histories alone. He needed to systematically recreate catastrophic facial impacts in a controlled environment. In 1901, he set up a workspace dedicated to this exact purpose. It was an environment defined by strict academic rigor, though the materials he required were undeniably macabre. The historical labs document 35 precise experiments. Le Fort performed these tests using intact human cadavers and recently decapitated heads. There were no cannonballs. He utilized specific, heavy instruments, thick wooden clubs, cast iron rods, and vice grips to apply pressure. He carefully manipulated the variables. By altering the velocity, mass, and angle of impact, he perfectly replicated the mechanics of real-world accidents. Some of the recorded methods were incredibly blunt. In specific tests, he simply took the decapitated specimens and threw them face first against the rounded edge of a wooden table. The post-impact analysis required immense delicacy. Le Fort carefully sawed off the cranial vault and detached the dura mater to inspect the base of the skull, ensuring he didn't trigger any secondary cracks during the autopsy. To expose the full network of damage, he took the remaining bone structures and boiled them. This cleanly melted away all the overlying soft tissue. When he lined up the 35 boiled skulls on his tables, the chaotic, seemingly random nature of facial trauma disappeared. A strict, underlying architectural logic emerged. No matter what angle the blows came from or how heavy the wooden block was, the midface consistently separated along 3 highly predictable fault lines. This schematic directly illustrates his exact findings, starting with the Le Fort 1 fracture. It is defined by a horizontal separation of the maxilla, running straight across the bone directly above the roots of the teeth and the palate. The second pattern, triggered by a direct blow to the mid-maxilla, is the Le Fort 2 fracture. This takes the shape of a pyramid, extending from the nasal bridge down diagonally through the cheekbones to isolate the central face. Finally, massive kinetic impacts create the most severe pattern, the Le Fort 3 fracture. This is a complete transverse craniofacial separation. The fracture runs entirely across the eye sockets and upper nasal bridge, completely detaching the face from the cranial vault. Le Fort had mapped out the human crumple zones. The facial skeleton is biologically constructed to shatter along these exact pathways, absorbing deadly kinetic energy before it reaches the central nervous system. These anatomical blueprints were almost immediately put to a massive scale test with the outbreak of trench warfare and heavy shrapnel injuries in World War I. Le Fort returned to the Army, taking his findings directly to the front lines. He earned commendations for bravery while performing rapid, complex reconstructive surgeries on shattered soldiers in active combat zones. Well over a century later, his 1901 publication remains the definitive standard. Surgeons across the globe still rely on these 3 lines to diagnose trauma and anchor reconstruction plates to the skull. Every neat, sterile diagram in a modern medical textbook comes from somewhere. Our ability to rebuild the human face was born from an obsessive, deeply visceral inquiry into exactly how it breaks.